Starting sometime in the Middle Ages, throughout many lands, there were bone setters who knew about splinting, how to treat broken bones with splints made from sticks, leather, and clay. They even had a guild, a medieval union of a sorts, a cohesive group of workers organized to ensure quality, consistency in education. Medical schools for physicians existed at that time, but bone setters, along with the surgeons, didn't attend those schools. In the 1700s, Nicolas André, a researcher and professor of medicine at the University of Paris, formally described splinting, a technique used by bone setters, as a method to treat bony deformities such as club feet in newborn children. He likened it to the straightening of a young tree sapling. André wrote a textbook on the subject entitled L'Orthopédie. The ancient Greek word orthos means free from deformity, to straighten. The ancient Greek word paidie refers to the art of raising a child. Literally, orthopedics means to straighten the bent bones of children. Together, they provide for the name of a present-day surgical specialty. Surgical methods in the 1700s and 1800s were very immature. Anesthesia was first developed during the early 1800s, and ether was widely used during the Civil War. After the Civil War, surgeons brought their surgical experience home to small towns throughout all of the U.S. It wasn't until after the war that we learned of bacteria and discovered we could avoid infection following surgery. In addition, X-rays were discovered by Wilhelm Röntgen in 1895, which allowed for the marvelous and revealing image of our internal bony structure. These advancements helped set the stage for expanding the focus of orthopedics from casting and making straight the bony deformities of children. In the 1890s, Evan Thomas, a well-known bone setter from Liverpool, England, encouraged his son Hugh to go to medical school. While learning medicine, Hugh learned from his father bone setting and casting methods, which at the time were not being taught in medical schools. And Hugh was influential in bringing this curriculum to medical schools. In practice with his nephew, Robert Jones, these two worked to develop orthopedic surgical methods in treating bone injuries in construction workers, and then World War I injuries in military men. Thus, we trace the evolution from bone setters and straightening the bones of children to anesthetized yet unsterile amputations during the Civil War, to bone setting taught in medical school, to surgical repair of bony injuries in World War I, and to the marvelous and ever-developing field of orthopedic surgery.